Hello everyone, welcome to my channel. In this channel, I will be sharing videos mainly related to primary care, like how can you give specialized care at the primary level. If you're a physician who want to set up your own primary care clinic where you treat the common conditions, you will be able to treat it equivalent to specialists if you watch these videos. And currently in this video, I'll be telling about Aphthous ulcers. Aphthous ulcers are like which we call as mouth ulcers or the canker sores. These are very common in our clinics. I at least see 7 to 8 patients every day just related to Aphthous ulcers. But sadly, I see doctors just prescribing vitamin B12. It is much more than vitamin B12. It is B12 deficiency is not the only cause of Aphthous ulcers. There are more than that. And in this video, we'll learn on how to properly treat Aphthous ulcers. So before starting my video, I'll tell you what are the references from which I am teaching this. With this, you will be able to understand that whatever I'm sharing in this video is all evidence based and you can directly use it for your practice. What are the causes of Aphthous ulcers? So the first cause is the stress. Like there is a college near our hospital, right? Whenever they have exams, I see many students come with Aphthous ulcers. Then physical or chemical trauma. Whenever patient is brushing or the patient had hot coffee or hot water, then they might end up having Aphthous ulcers. Brush and hot fluids. Then what are the other causes? Hormonal changes. So what happens? There is a drop in progesterone during the luteal phase, right? Even in that condition, there might be Aphthous mouth ulcers. So fourth is the food sensitivity. Most of us know that there is sodium lauryl sulfate in shampoos. Apart from shampoos, it is present in toothpaste also. That also can cause food allergies like pineapple, cinnamon, cheese, figs. They also can cause Aphthous ulcers. Hematinic deficiency. This is very, very, very important. I have seen people prescribing only vitamin B12, but it's not just that. It can be due to iron deficiency. It can be due to folate deficiency. It can be due to B6, B12, or zinc deficiency. Apart from that, um, any condition which will cause these deficiencies can also cause Aphthous ulcers, like celiac disease, where there is malabsorption, also Crohn's disease. Then Behçet's disease and reactive arthritis, out of which important things are this deficiency, like um, vitamin or the mineral deficiencies and the food allergies and stress. How do you diagnose Aphthous ulcers? Now, if you see this image, can you see it is present in mucosa, right? It can be present in buccal mucosa, labial mucosa, mainly like non-keratinized epithelium. It is present in non-keratinized epithelium. Now, if you see this image, this is the Aphthous ulcer, right? And it is surrounded by a hyperemic border. The border is hyperemic border and it is surrounded, it has the floor of this ulcer has a gray pseudomembrane. Pseudomembrane. This is how you diagnose. They are very painful. So first they are painful and they are oval or round in shape. They have a hyperemic border with gray pseudomembrane. They are present in non-keratinized epithelium. Next, the same. Round oval shape with a gray pseudomembrane. What are the non-keratinized epithelium? They can be present in the buccal mucosa. They can be present in labial mucosa. Then undersurface of the tongue, lateral border of the tongue, soft palate. Mainly where there is non-keratinized epithelium, there these ulcers are present. So once you identify that this is Aphthous ulcer, you need to check what is the severity. Now, types of Aphthous ulcer, right? Knowing that this is just Aphthous ulcer is not sufficient. You need to categorize it. So let us know what are the categories of Aphthous ulcers. First, minor. It means that it has mild pain. There are only 1 to 5 lesions of less than 1 centimeter. It heals by 1 to 2 weeks. Second is the major. So the ulcer is slightly deep. It is more than or equal to 1 centimeter. The problem with this is it heals by 6 weeks. Then herpetiform. So herpetiform has very severe pain. They are like vesicles. Even though it has very severe pain, it will heal by 1 to 2 weeks. Why is knowing this important? Because the management will change accordingly. So if it is minor or herpetiform, you will have to mainly concentrate on relieving the pain, right? The patient will have pain and you will have to relieve the patient's pain. Whereas if it's a major, right, you will have to relieve the pain. Also, you will have to reduce the duration of the ulcer. Reduce the duration. That is why knowing these types are very, very important. So this is the minor ulcer. If you see the same, it has a red erythematous border, pseudomembrane, but here it is very shallow. Then this is major. Now compared to this and this, you can see that the ulcer is very deep. Third is the herpetiform. Can you see here? Like these are the vesicles. These are very, very painful. These are the herpetiform type of mouth ulcers. Now, evaluation. First, identify, understand, is it Aphthous ulcer or not? Yes. Then identify the trigger. What caused it? Did the stress cause it? Did any, physical or chemical trauma cause it? Or was it any hematinic deficiency that caused it? To check for hematinic deficiency, you will have to do the complete blood count or at least the hemoglobin levels. If the patient is anemic and the patient has Aphthous ulcers, it means that some iron or B3, B6, these deficiencies, B12 deficiencies actually caused Aphthous ulcer. Or is the patient allergic to any of the food like pineapple, cinnamon? Identify the trigger. Then identify the severity, like is it minor, is it major, or is it herpetiform? Now, managing Aphthous ulcers. Whenever you're managing Aphthous ulcers, there are two things which are very important. One, you will have to manage the pain, and second will be reducing the ulcer duration. Now, what can be used to manage the pain? They are mainly local anesthetics. They are local anesthetics. To reduce ulcer duration, there are only like 3 things which can reduce the ulcer duration. So one is topical corticosteroids. Then there is a drug called as amlixanox. Then there are antibiotics. I repeat, reducing the ulcer duration is very, very important in what kind of ulcer? Major type, where it is more than or equal to 1 centimeter, the ulcer is deep, right? Now, so I told topical corticosteroids. Okay, I will repeat. I have not been paid by any pharma companies to write the brand names. Okay, I'm just writing the brand names because it will be easy for you to memorize. And also, I have also included the this one, what the cost of these medications, so that whenever you're treating the patient, you know how much it might cost. So first, as I told, topical corticosteroids, out of which triamcinolone is the commonly used one. 0.1% of oral paste is available, it will reduce the ulcer duration. The brand names are Oraways Oral Paste. I repeat, I have not been paid by any of the pharma companies. This is just for your better practice, like handy practice, to make your practice very handy, I'm telling you. Oraways Oral Paste, which costs around 83 rupees. Then Tess Oral Paste, 99 rupees. Kinacort Oral Paste, around 150 rupees. Topical corticosteroids, then as I told, Amlexanox. This also reduces the symptoms and accelerates healing. So this will topical corticosteroids will be applied 2 to 4 times a day. Even Amlexanox paste will be applied for 2 to 4 times daily. There is a brand called as Lexanox Plus. It has Amlexanox plus lignocaine. So this, if it is available in your pharmacy or the nearby pharmacy, you can actually prescribe it, and it costs around rupees 140. Next will be anesthetics, like as I told, for the pain. Lignocaine 2% gel or lignocaine with choline salicylate 2 to 4 times a day. The brands available are Glencore Oral Gel, which is 60 rupees. Then G-Cure Mouth Ulcer Gel, which is 26 rupees. And Orasor Mouth Ulcer Gel, which is 66 rupees. So these are the things which will actually, for pain anesthetics, the common brands are Glencore, G-Cure and Orasor. You can use Amlexanox, the brand name is Lexanox Plus, or you can use topical corticosteroids where the brand names are Oraways, Tess or Kinacort. Then, apart from that, we need to correct the nutritional deficiencies, like as we discussed, they might have iron or vitamin B complex. Correct it. Then educate about the possible triggers. And one more which also reduces the ulcer duration is actually antibiotics. That is tetracycline and minocycline. There is 250 mg capsule available of tetracycline. Tetracycline 250 mg capsule is available. So what this has to be done, this capsule, the powder of this capsule should be dissolved in around 1 glass of water. You should ask the patient to swish it and spit it. This is also at least 2 to 4 times a day. It's like swish and this is called as actually swish and spit technique. This also actually reduces the duration of ulcer. But the main problem with the tetracycline group of drugs are they cause teeth discoloration and they're harmful for fetus. That is why it is contraindicated in pregnancy and children. So this is how you evaluate Aphthous ulcers. So this is just the beginning. Stay tuned. Now, for example, if a patient is now coming to you with Aphthous stomatitis, now understand what can be given to the patient, right? So is it just now please do not give B complex alone. Say if it's minor, you can give either just anesthetic or you can give Amlexanox. If it's major, you will have to give both. You will have to give anesthetic as well as the topical corticosteroid, which is 0.1 triamcinolone. This is just the beginning. I will be sharing much more videos on how do you give state-of-art primary care. Stay tuned for more videos.